reopening, chart a course with the best information you have, learning from the lessons you have, but be able to correct that course depending on what happens. Which means don't act emotionally, don't act because I feel this, I feel that, because someone said, well, other states are opening, so you must be able to open if other states are opening. Forget the anecdotal, forget the atmospheric, forget the environmental, forget the emotional. Look at the data, look at the measurements, look at the science, follow the facts. And that's what we've done here from day one. This is no gut instinct. This is look at the data, look at the science, look at the metrics, move forward, measuring what you can and what you know, and then be prepared to adjust. Well, I want specificity. I want to know for sure. You don't. But there's liberation in knowing that. So let's do this intelligently, based on metrics, and we'll see what happens, and we'll adjust to whatever happens. Well, what does that mean on metrics? You can measure this, and we have to measure this. You look at that percentage and the rate of hospitalizations, which we have, right? That's the chart that goes up and down. You watch that hospitalization rate. Do your diagnostic testing so you know how many people are testing positive, and you can watch that rate going up or down or flat. Do the contact tracing. So after the testing, you follow up and you do that contact tracing. And you are then reducing the infection spread by isolating the positives. If you do those things, you will control the rate of transmission of the virus, which is everything. Nobody says you're going to eliminate the virus in the short term. Nobody. But you can control the rate of transmission. And if you can control the rate of transmission, you can control the rate of transmission from becoming an outbreak or an epidemic or overwhelming your public health system. That is the best you can do. So control the rate of transmission to what they call 1.1 or less. 1.1 is every person infects 1.1 other people, more than one other person. If you're doing that, that is an outbreak. That means it's going to increase exponentially and it's going to be out of control. As long as your rate of transmission is manageable and low, then reopen your businesses. And reopen the businesses in phases, so you're increasing that activity level while you're watching the rate of transmission. Rate of transmission goes up, stop the reopening. Close the valve right away. So reopen businesses, do it in phases, and watch that rate of transmission. It gets over 1.1, stop everything immediately. That's where the other countries wound up. They started to reopen. They exceeded the 1.1. It became an outbreak again. They had to slow down. Rather than starting and stopping, you'd rather have a controlled start so you don't have to stop, right? And that's what you learn from the other countries. You reopen too fast, then you have to stop. And nobody wants to have gone through all of this and then start just to stop again. Well, how does that happen? First of all, it's not going to happen statewide. This state has different regions which are in much different situations than other regions in the state. And rather than wait for the whole state to be ready, reopen on a regional basis. If upstate has to wait for downstate to be ready, they're going to be waiting a long time. So analyze the situation on a regional basis, okay? And you look at a region on 4 measures: the number of new infections, your healthcare capacity. If the infections goes too high, you overwhelm your health system. Now you're Italy with people on gurneys in a hallway because your hospital system can't handle it. do your diagnostic testing so you're seeing how the infection is increasing or decreasing, and do the contact tracing, have that system in place so when you test and you find a positive, you trace the contacts from that positive person and you're isolating them to bring down the rate. And you do that on a regional basis. That system has to be in place for a regional basis. How do you start? When can I start reopening? We look at guidelines from the CDC, which say a region has to have at least 14 days of decline in total hospitalizations and death on a 3-day rolling average. So you take a 3-day average, you have to have 14 days of decline. You can't have more than 15 new total cases or 5 new deaths on a 3-day rolling average. This is telling you that you're basically at a plateau level that you can actually start to reopen.